see. I think we're done. So let's give it a couple of minutes. Good morning, Dr. Alon. How are you?
I'm good. How are you?
Good. Thank you for waking up. I know you got home at 3 a.m. So we truly, truly appreciate you joining us this morning. And I know you have a lot going on and you have a family as well. So you're giving us some time and we truly appreciate it. So bear with me one moment.
And no worries. My pleasure. Thank you for having me on.
Of course. Of course. The people always like to have information. So if we can get them information, that's, the more the better.
Yep.
So let's see. Okay. Okay, so we're here, oops, sorry about that. We're here this morning with Dr. Alon Payenson, who is the medical director of DoctorsOnCall365. He's also an ER doctor here at Memorial, the one that's close to us here in Cooper City, which is Memorial West. I had to think about that. I gave birth at one of them. I took the kid to another, there's so many of you guys. So it's a good thing. We're happy to have so many Memorial properties here. So what we're going to do today is kind of have us explain. You're not on the scientific side, you're on the clinical side of everything. So we'd love to have you kind of explain to us what is going on. How could you synopsize everything for us in layman's terms so that people without an MD can understand? How are you guys doing? What's going on?
Right. So in terms of how we're doing okay. It's definitely does not look the way it looks in New York, so we're lucky. I don't know if that's because we're behind New York in a couple of weeks and it's going to get that far, or we distanced early enough and did the right things early enough that we've done the right things to hold off and flatten that curve, and we're just going to see a spread of this disease coming into the hospitals. I can't tell you about every other hospital in this county, but I can tell you that ours is doing okay. We're prepared. We're ready if a surge comes. Our administration, as far as I know, has done a fantastic job of being ahead of everything. So we're okay right now. We're kind of waiting for that shoe to drop if and when we should get a surge. But as of right now, yeah, we're working hard. We're still coming in and out. We have sick patients. We have corona patients. But it does not look like it does in New York, at least not in our hospital. So we're in the lull, which is a good thing. Hopefully it doesn't get there, but we're prepared.
Everybody's talking about a peak.
Right.
What is this peak that everybody's talking about?
Peak is the number of cases. So when we continue to have an increase in cases on a daily basis, then we're still on that upslope of a curve. And when we start seeing a decrease in number of cases, and every day it's less and less and less, even though we're getting positive cases, but it's less than it was the day before, and then less than it was the day before, then we should start getting on a decline of it. We also know that people get really sick a week to 2 weeks out. So we may not have seen all the ones that are going to get sick, truly sick yet, that require hospitalization or further intensive care. So we're kind of sitting in that lull, waiting to see if and when we hit that top of the curve when more and more people are getting sick, and then also waiting to see if we get that surge of people that require hospitalization.
Is there something that us as a community can do, except obviously stay home? We're all staying home.
Right.
And now the Broward County has enforced wearing a mask when we're going outside, and what can we, and wash our hands, of course. Wash our hands. I mean, everybody's skin is probably a little bit dry, but that's a good thing at this point. What can you recommend to everybody to do so we don't get to see you?
Right.
I mean, nice to see you, but we don't want to see you.
Right. So exactly what we're doing. Social distancing, going out in minimal groups. One person goes out if you have to obviously get gas or get groceries and things like that. And mainly washing hands and not going out if you are sick. So if you are somebody with upper respiratory symptoms, cough, runny nose, congestion, fever, A, it doesn't mean you have corona. B, if you have it, it might be a mild case. but you do not need to be around others and spreading it. There is concern of sort of the, asymptomatic carriers, and that's why they instituted the masks of even if you feel fine, maybe somebody has it and you don't need to be spreading it around. The number one thing is washing hands, not even so much wearing gloves, but washing hands before you get into the store, after you get out of the store, not touching your face. If you don't touch your face, the virus can't get inside. It can't get into the mouth, the nose, the eyes. So washing hands, not touching the face, and following the rules as they are right now. I think it's working, and anytime we do prevention, it's hard to tell what it would look like if we didn't do it. But I think we're doing the right things, and if we keep doing it, I can't tell you exactly how long, but the idea was to not get the hospitals overwhelmed like they did in New York and Italy and Spain. And I think that's working because we're able to take care of the patients that we have to take care of because there's other things still going on like strokes and heart attacks and belly pains and things that need to come in on top of the corona. So as long as we are able to keep doing that, I think we're doing the right things.
Have you seen people, I mean, this might be a kind of weird question, but if you've seen people that are kind of afraid to come in and be taken care of because they're afraid for other things that are not corona related because of the corona?
Yes, and I think that's one of the misconceptions that we also have to correct a little bit, that if you're having symptoms that you would otherwise have gone to the hospital, you still need to come because there are things that can happen, quarantine or not, virus or not, pandemic. There's other things that can still happen in your life that need to be checked out. So if you're having appendicitis or if you're having a stroke or if you're having some numbness or tingling or some other things that you were concerned about before this pandemic started, you would have had checked out. We're still open. We're still seeing patients. I think all hospitals have done this, but we've done this. We have sort of a corona side where we suspect people with corona and upper respiratory symptoms, and we have a clean side. So we're taking every precaution not to cross-contaminate and to keep everybody safe, and the hospital itself too. So if you get admitted for a heart condition, you're not going to be around other corona patients. They are kept in one area.
They're isolating people. This one has this one has that. Okay.
Right. Until somebody's proven to yes or no, or if there's some patient that's under suspicion and we're investigating, they stay in one particular unit. It's negative pressure. So we're doing all we can to take care of all our patients and not cross-contaminate from one group to the other. That's in the ER and on the hospitals. One main thing is if you're having a question like, should I go, should I not go? Every primary care doctor, my company, urgent cares, everybody's doing telemedicine. So if you have a question, the easiest thing to do is pick up the phone, connect with a doctor, either us or your primary care doctor, tell them the symptoms, tell them what's going on, and then they can A, call in prescriptions, B, tell you, nope, this needs to get checked out, you need a CAT scan. Or C, wait a minute, wait a day, I'll follow up with you tomorrow. So the medical community is still functioning. We're still there, maybe not doing office visits as much, but we're there to evaluate patients and make sure that everybody gets properly taken care of. Because the worst thing you want to do is stay home with a critical condition, and then 3 days later you go to the hospital and it's 3 times worse, and now maybe we can't take care of it as effectively.
I know we covered the part of talking about what to do in order to prevent myself from getting exposed, stay you're isolated in your homes, cover yourself when you're out. Mask is enforced in Broward. I'm not sure, do you know if Dade and Palm are also enforcing it?
I think Dade is, I think Palm is starting to, again, the mask is not so much for you getting it, it's more for you spreading it. Gotcha. So the mask isn't going to prevent you if you touch a surface that has corona and then you touch your eye or nose. Doesn't matter if you have a mask on or not. It kind of maybe stops people from touching their face as much, but it's more of if you sneeze or cough or you're a carrier from you spreading it onto others. So the mask is not so much protective from getting, it's more protective to others.
So we just got a question texted to us, and that's okay, people. If you'd rather text me, that's quite all right. I'm absolutely okay with it. Some people, if you want to text me, my number is 305-942-7446. Some people don't feel comfortable in posting in a live chat. So a lady named Stacy is asking, why is it our face? Why does it have to do with our face? Why is it not any other body part of the body?
Right, because it's an infection that requires a certain receptor. It's a virus requires a certain entry point. It can't go through skin. Our skin is a protective layer, so it needs what's called a mucosal layer, something that's absorbing. So it's either the inside of the mouth, the inside of the nose. Eyes can also be a pathway. So most viruses, whether it's influenza or the coronavirus or even bacteria, for the most part, have to enter through some sort of portal. So if you touch it with your hands, it's never going to get through skin. Our skin's protective. It can't really get on it. It's not really bloodborne, so it's not going to get in any other way unless it's through the mouth, nose, or eyes. You can get it through spread if coughed directly into your face. Most people say that it's about 6 feet of distance, which is why we have the 6-foot rules everywhere you go of keeping distance and social distancing. But if you sneeze or a cough, it gets aerosolized up to about 6 feet. But mostly it's going to be if you cough, sneeze, touch a surface, it can live on surfaces a long time. You go touch that surface, and then you touch your eyes, nose, mouth, and then that's the way it enters your body.
So I'm a realtor. Ta-da, as if you didn't know. I'm a realtor and I show homes. Now, I only show vacant homes at this point.
Right.
The other homes, I do virtual tours. I showed a home yesterday here in Cooper City and South Broward, and I gave my people, I got them gloves. I wanted to make sure they have gloves on. God forbid they touch a surface and then touch their face. But, and I think that's one of the most important things. You got to remember, like Alon said, like Dr. Alon said, sorry, I got to get used to calling you doctor.
That's okay.
Like he said, that don't touch your face. And with kids, it's really challenging. And with showing homes, you get emotional and everything else. So I tell them always come with a mask, come with, God forbid there's somebody else there that might have been exposed or is exposed. And come with gloves. That's the correct thing to do.
Mostly it's if cleaning surfaces. So whatever they're going to touch is sanitized or cleaned beforehand will probably help. So they're going to touch doorways. They're not going to touch, every single surface.
They touch countertops. They open
Right.
cabinetry.
Right.
Okay.
So cleaning that, but it's really for them not touching their face. So wash your hands beforehand and wash hands afterwards. Because even if you have gloves on, it doesn't prevent you from touching surfaces and then potentially, scratching your eye or doing something that we do subconsciously. Exactly. So because I'm sure all of us have seen, you go to the supermarket, people are wearing gloves, but they're touching their cell phone, they're touching their wallet.
That was my next thing. They're
eating a banana, they're eating their protein bar with the gloves on. It does nothing because you're cross-contaminating everything with the gloves anyway. So the gloves, not so important. Masks, again, it's more protective for others. It's really just washing hands and not touching your face. You can touch all the surfaces you want. As if you didn't touch your face, the bacteria can't get into your body, or the virus, can get inside, and you basically are preventing the spread. If you wash your hands, you can wash your hands. You touch something, have some sanitizer, sanitize your hands. You open another door. That's kind of what I'm doing is, I wear gloves when I touch the patient, but then I take them off, I wash my hands. I go open the door, I wash my hands. I touch my badge to open up something, I wash my hands. So yes, it is a lot of washing, a lot of sanitizing, but that's really the safest way to try to keep it out of our body.
Sorry, I'm reading the text that just came in.
Okay.
I'm very open about having a pre-existing condition, about being immune compromised. I'm very open and I'm very supportive of what I have, which is ulcerative colitis. Are people like me at risk having that pre-existing condition that isn't respiratory?
At risk, not necessarily of getting it, but being more susceptible once you have it. And having the condition itself is one thing. Being on immune suppressive medications is really what suppresses your immune system. So some people might have lupus, but that doesn't, that is a pre-existing condition. But if they're not on immunosuppressives, they may be just as equally susceptible as everybody else and deal with it as well as everybody else. It's not so much the susceptibility to the virus. It's, we could all be easily susceptible to it, but it's just sort of how your body fights it off. So yes, those that are immune compromised, we worry about more because they could get sicker as opposed to the general population.
Okay.
And same thing with elderly and the other at-risk populations.
Gotcha. Okay. So, I mean, if you just got to be careful no matter what, but
Correct.
obviously with something that already exists for
Correct.
30 years, yay, you obviously have to be a little bit more cautious.
And we've seen it. I mean, it affects everybody across the board. I mean, there's stories of people that are young and healthy and have no pre-existing conditions. It's all statistics. So yes, those with pre-existing conditions like heart disease and lung disease and those that are on immunosuppressive medications are more susceptible. Doesn't mean that they won't recover, because a lot of them will recover. And the same thing, it doesn't mean that if you're young, healthy, and have no pre-existing conditions, you won't get sick and you won't get really sick. So it's all about statistics and probability, but it sort of affects everybody. But there are definitely a higher percentage of vulnerable people in immunocompromised and elderly.
What about the theories that are going around? I don't know if it's a conspiracy theory or not, that this thing doesn't survive in colder weather. We have a couple of people from Wisconsin and Illinois that are sitting here, that are watching us, and texted me, and they're asking, they're actually asking the same question. Is this something that in colder weather has more, does it stay more? I know it's a little bit scientific, but maybe you know the answer.
I don't. I don't know if temperature affects it as much. We know that influenza doesn't really matter because you get sick. Actually, more people get sick in colder temperatures because they stay in and cohort a little bit more, so it spreads a little bit easier. But we have influenza down here, so it's sort of across the board. We're also seeing influenza in cold weather countries. Europe has a regular winter, maybe not as cold as Wisconsin, but they're getting cases there. So there's cases all over the world. So I don't know the exact duration that it can survive in colder temperatures. What I will tell you is that, my opinion is maybe Wisconsin is a little bit less affected because their population isn't as dense, maybe outside of the city. Right. So, I mean, you can see that here too. And New York is getting badly hit, but they have a very high density of population. Ours, especially in Cooper City and the area we're in, is a little bit more spread out. People aren't on top of each other. It's not. The infection rate is not as high. So I think that might be more to do with it rather than the temperature, because New York is cold too, and they're probably the worst hit right now. So
my cousin's wife is watching us from California, so I can tell you it's not doing as well over there either.
Right. So I think the temperature itself is irrelevant. Maybe we're hoping also that maybe the warmer temperature will help us out, but I don't know the exact numbers.
Okay. We're in the 90s today, so we're headed the right way, I guess. A different Stacy is asking, who's here in Cooper City, is asking, how long does it live on surfaces? How long should I let my Amazon package from New York sit? It has medical masks in it.
Right. So for the most part, there's all sorts of websites where you can look this up. But I can tell you that metal surfaces, it will last longer, and cardboard or paper surfaces, it lasts the least. So most numbers I've seen is cardboard and paper is about maybe 1 to 2 days, and metal surfaces such as silver surfaces or stainless steel is longer, up to 5 to 7 days. So that's why doorknobs are kind of the highest rate of effect, and countertops and things like that. But we keep our masks and certain things that the hat, the skull cap that I'll wear in a hospital, or my big face shield and things like that, we'll keep them in paper bags. And the idea is that within 24, 48 hours, the virus doesn't know where to go, and it can't really survive on that surface, and it should sort of die off. So if you're doing cardboard and you really don't want to touch it, and Amazon packages, I would say about 48 hours, you should be okay. The other thing to do is you can open it. Maybe in the garage, so it's not getting inside the house. Open it, take whatever stuff you have, wash that, then wash your hands, and you should be fine. Again, it's all about giving the virus access to your body. If you touch it with your hands, you'll be okay as long as you don't cross-contaminate other surfaces. So whatever you have in a package, open, take it out, station it in your sink, wash your hands, wash the product, or let the product sit, because hopefully whatever is inside the plastic bag should be clean. So you can open the package, wash your hands, take the stuff out, again, wash your hands, and then you're safe. So it's really about giving the virus access to enter our bodies and affect us.
Right.
And then cleaning up whatever surfaces are touched by the product.
Lori's here from Cooper City. She's asking, how confident is the medical community that positive results mean we will be immune for at least this season?
We don't know.
A heavy question.
So we don't know. There are rates of reinfection around the world. You have to remember that about 1 million people are affected, probably more than that. There are reinfection rates, but they're not high from what we're seeing. So it can happen, but it's rare. I still wouldn't force the issue. So if you had it recovered, I wouldn't now walk into other places with COVID patients and think that you're immune from it. But it should give you some immunity. I mean, we know that people can get influenza twice within a season. Again, it's rare, but it's possible. The short answer is we just don't know because we haven't dealt with this virus in this capacity and this strain ever before. So we kind of have to see what happens. There could be some reinfections. Again, around the world, it's been rare. There's a few cases that have been posted, but it shouldn't, hopefully, give you some immunity and it should give you some protection. But I still, again, wouldn't push the issue about, it's like, well, I had it. Now I'm free to go do whatever I want. So I would still follow the rules and be protective and wash hands and do all the things even if you had it.
What about, there is a lot of people asking, and there's something that I just saw this morning that actually my husband shared, that David shared, that is talking about plasma of people who have been sick. I know, obviously I'm not going to disclose, but I know of one person who's been sick. He was watching us. He has a Zoom link, so he won't be on the live, but he is watching us, and that's a question that he's been asked. Can you come in and can you give us plasma? Yes. So it is a therapy that we think will help. Again, the science is, sorry, my printer went off. The science is moving at rapid pace. We're combating this thing in real time. Usually anytime that you have therapies and treatments, it's taken years to prove. You've done some studies, you've looked at people that you've given it to and not given it to, you've had some control groups, and you've had some time to study. We're doing everything sort of in real time. So we don't know the exact effect. There is a theory that plasma from people who have had it and have antibodies can help those that are sick. But that takes time. So I think One Blood is looking for people with donations or people that have had the virus and have tested positive or not recovered. But there is a lot of rules to go along with it. So you have to be symptom-free for about 2 to 3 weeks. You can't be sick anymore. You have to be fully recovered. I think they're also looking for the number of antibodies somebody had. But yes, it's going to take time. So One Blood needs to get the blood from people that have now recovered. Within a 2-3 week period of where they've been symptom-free. That's A. B, then they have to process it. C, then they have to make it available to all the hospitals. And as you know, we have a lot of hospitals in the area. You have to be sort of in the program in order to get it. And then you have to cross-match the patients. And then you have to go through the process of giving it to them. So, the act of getting even just regular blood is a complicated process. So yes, the theory is out there that this could work. Our hospital is participating in it. I don't think every hospital is participating in the program, but we are. But we have to go through a lot of steps in order to get it. So it's the therapy's there. I don't think our hospital has any samples yet because we have to have a large enough recovered population to be able to get the plasma from. On a different note, so going back a little bit to something, my neighbor Berthy is asking a question. Buen dia, señora. What is the recommended social distance? 6 feet has been recommended, but in the past few days, I've heard 13 feet. I haven't heard that one, so maybe. Yeah, I think 6 feet is safe. Again, it has to come to you somehow. So the other person has to, let's say somebody's affected or infected with COVID, it has to get from them to you somehow. We don't think that it's airborne in the sense that it's getting up into the air conditioning ducts and it affects everybody around you. It can travel in air. Most scientists think that it's about 6 feet or so for enough of a viral load to actually cause any kind of symptoms. So again, somebody coughs 6 feet in front of you, they don't have a mask, they didn't cover their mouth, it gets up into the air particles carry it, and it goes about 6 feet, and you have to inhale it and sort of enter your body.
I think 6 feet is fair enough. Again, most of us are not sick. So again, if you're sick, the main thing is staying home, that there's no risk 6 feet or 13 feet of anybody else getting sick. If you're an asymptomatic carrier, again, it's not going to jump off of my body to get to somebody else. Physically has to travel either through a cough or a sneeze or through surfaces. So I think 6 feet is fair. And again, it's more about washing hands and not touching your face. And we're trying to make sure that, it doesn't go from one person to another. So we've kind of 6 feet is I think, not necessarily the average, but I think a safe distance. So I think that's fine.
Okay. More on the medical side, are antibiotics effective in preventing this or in treating this?
Not so much in treating it or killing it. There's one antibiotic they're using in a hospital setting, or which is called azithromycin. It doesn't do anything as far as killing the virus. It helps with the inflammatory side of that immune response that everybody's been talking about. So the virus itself really, it's just replicating and making more copies of it. What gets people in trouble is the body's reaction to it, and it sort of gets overreactive a little bit. And that's what can cause people to get really sick. So there is a therapy that they're using in the hospitals. It's not really, again, doing anything to kill the virus. It's just helping those that have that revved up immune system and that immune response to help calm it down. But you have to remember, all the studies, all the treatments that we're doing, none of this is proven. It's all theoretical. It's all anecdotal. It's based on few case studies and not necessarily good clinical control trials. So it works because we've seen a handful of people get better maybe. We don't know if they would have gotten better anyway. So there is thought that it helps, but I wouldn't say that it's the all-out cure. So, people have called me and said, like, oh, can I get a Z-Pack? I'm like, well, A, you're not sick. B, you don't have symptoms. And let's hold off to those that actually might benefit from it or in a hospital or having that immune response and see if we can fight that off. Because if we have a run on these medications, then there's not going to be medications for those that actually need it. So yes, we're using it, again, with minimal proof, and we're using every therapy that we've seen may or may not help as a sort of end kitchen sink approach of, well, it's worked in a few people, let's see if it helps, and maybe we can get some people recovered.
But don't start taking anti-malaria drugs, or don't start taking other drugs, please. We've seen
they all have side effects. So, people need EKGs, they can cause arrhythmias, they can cause deadly conditions. So just taking things blindly, definitely not recommended. And again, we need enough so that we can treat those that actually truly need it, as opposed to, just like what happened with masks. We had a run on masks, and now hospitals are getting short and our supply chain is getting short. So we kind of need to save it for those that truly need it. And some people are going home with it, but again, they have to be confirmed positive and certain symptoms, and there's certain guidelines. So, it's changing on a daily basis, but the medical community as a whole is sort of talking to each other and fighting this as a unit across continents and coming up with protocols every day.
In what cases should we come to the hospital? Or in what cases should we call you guys at DoctorsOnCall365?
Yeah, you can always call and text if there's questions. I try to be as available as I possibly can. Like you said, I do have a full job in the emergency department, plus running my business and the family. So I try to be as responsive as I can. If you think you have COVID-19, then the times to go to the hospital is when you're experiencing shortness of breath. If normally you can walk fine and you take 10 steps and you're getting really winded and short of breath when you shouldn't have, when it's not getting better on its own in 4, 5, 6 days, the fevers are not getting better, then it's time to come in and get it checked out. Really, the main thing we see with people that are finally coming in is shortness of breath. They just can't take a few steps, they get short of breath. It's not getting better on its own, it's starting to get worse. Again, we have all the systems set up to treat our COVID patients. A lot of times they'll end up going home. They might go home with some treatments depending on what symptoms they have. We'll test them. We'll keep an eye on it. The CDC is aware of it. Sometimes they come back. Sometimes they don't. And sometimes people are sick enough or the oxygen level drops far enough that we'll keep them overnight. Some people can get a pulse oximeter, like the little thing that goes on your finger that measures your oxygen level. And as long as you're in the high 90s, your lungs are doing okay and your body's compensating. If it starts to drop below 90, 95, 94, then it's time to come in. But it's really symptoms and shortness of breath. And if they're not getting better over a week and doesn't feel like a common cold. But you can call your primary care doctors. Again, you can call your insurance, telehealth. You can call us. Roni can put the number up and a link up later. You can call us and we'll have a conversation, and then somebody's keeping an eye on you, and there might be a trigger pull that you have to go to the hospital. And if it's not COVID-19, then again, if you're having chest pain, if you've had a heart history, if you're having numbness or weakness or any stroke-like symptoms, things that you would have gone to the hospital for 30 days ago before this all started, if you're thinking something's not right, but I don't want to go because there's COVID patients, you still need to come get checked out. And we're doing everything we can to take care of everybody with every condition. It's not just time to treat COVID-19. It's time to treat, there's other illnesses and other things that need to get checked out. There's a patient who called me on my line, said, I'm having belly pain. I don't feel good. I said, well, they thought maybe it was food poisoning. I told them to take some medicine. If not, get it better, go to the hospital. She ended up having appendicitis. I'm glad they didn't wait. Because, man, if they would have waited, it could have gotten worse and the surgery could be more complicated. So we're still taking care of all the other patients.
Wow. Is there anything that us as a community, be it South Broward, be it Cooper City, be it Davie, Weston, wherever anybody is that's watching, what can we do to help you guys at Memorial? Our friend Rory Morland has been bringing you guys food. Our other friend, Eric.
I have to say that our community of South Broward and especially Cooper City has been amazing. The love, the support, the food deliveries, the mass deliveries. I put a request out for some products, and I was overwhelmed with the amount of companies that stepped up to provide us with with the product I had asked for. So our community is amazing, and I want to thank everybody for the true support and the shows of love and everything that everybody's doing. Basically, keep doing what they're doing. It's really helping us that people are staying home. It's really helping us that people are staying home, especially if they're sick. Trying to minimize that curve as much as we can, because again, we're still treating everybody else. And if we get a surge in COVID, then we can get overrun. So. Keep doing exactly what we're doing. I think people are noticing that there's a little relaxation of the quarantine and maybe more people on the road. And it's like, well, it's been 2 weeks. We should be okay. Keep doing what we're doing. I know it's hard on businesses that are closed, and I know it's hard on people that are losing jobs. And I think the economic fallout will also be terrible. And then we have to kind of switch from supporting the hospitals and the frontline workers to supporting the rest of our community. But essentially keep doing what we're doing. I think we're, as of right now, we're doing okay. So I think that's because of all the preventive measures we put in place. So I think everything that needs to be done is being done as of right now. So.
Okay. There's an article that Bianca and Berthy sent us that is, sorry that I'm looking down.
Okay.
It's from The Hill. About the 13 feet that they were talking, the 13 feet that they were talking about, and I'm simultaneously doing a little bit of research.
Right.
Yes, it says that research, as far as what it says that research is saying, yes, try to stay 13 feet, but according to the CDC, what it says on the CDC side, it hasn't changed. It's still 6 feet. So
I think also 13 feet is also for us that work in the hospital when we do sort of aerosolized procedure. So if we're intubating, we're giving nebulizer treatments, we're doing certain things that make it more airborne. It's a slightly higher risk for us because we can make it more airborne by some of the interventions we do. So that's where we're taking the extra precautions. You see some hospitals have larger masks on, they have respirators and things like that. So we make it a little bit more airborne just by certain procedures. But in the general community, general population, I think I would just follow CDC guidelines for now. Remember, there's going to be a lot of data. There's going to be a lot of studies from here, from there, from sort of all over the place. So if you follow, my recommendation would be to follow a consolidated center that's taking all this data and putting it together into one package. So either the CDC or the World Health Organization, because really what they're doing is putting all these studies, I guarantee you they're looking at everything that's being published and putting together recommendations based on the best science available. So I think 6 feet for most people is fine, especially if you're wearing a mask, especially if you're asymptomatic and you're not coughing or sneezing. If we're standing in a line, we're not facing each other. So again, it's kind of hard for it to travel and make a 180-degree turn and then sort of enter. So I think that is the distance. I think is okay as far as social distancing. I think 6 feet is fine. It's really the matter of surfaces, washing hands, and not touching your face. That's really kind of what it boils down to.
What services can we call doctors? Can we call your Doctors on Call 365 for?
You can always call me. There's not everything that I'm going to be able to handle and not everything that I will do a house call for. So I don't charge for anybody to call me. You can text me, you can call me, we can have a conversation. The easiest thing to do is to text, because sometimes if I am on shift, I can't get on the phone to talk, but I can always reply to a text within a few minutes. So you can always text me a question. The answers might vary from you have to go to the hospital, I'll call in some medicine, or I'll come by and I'll see you. So I'm trying to avoid exposure. So anybody who has upper respiratory infections, cough, fever, runny nose, congestion, things like that, I'll probably do more telemedicine and call stuff in and kind of keep an eye on it through my telemedicine service and try to treat it that way. If somebody fell and just has a laceration or a rash or something that's not respiratory, then I don't mind doing a house call for. And sometimes I might be like, in case of my patient had abdominal pain, I'm like, try this. And if it's not better, there's nothing I can do bedside. You need a CAT scan, you need imaging, go to the hospital.
I bet you anything, there's like a million parents out there that said, stop doing that because I don't want to go to the ER. I don't want to go to the hospital. I don't want to go to the doctor. I know our kids, right, when they run up and down the stairs, I'm just waiting for somebody to break something.
Right.
So yeah, parents continue doing that. It's okay. Right. You're not alone.
Right. I just built a parkour course in my backyard, so I'm sure somebody's gonna fall off of there, but I have enough stuff here that I can patch them back up. But yeah, again, so the answer to your question is you can call me. My shifts vary, but you can always leave me a text, and I'll do my best to get back to everybody. And again, the answers will vary. I try to do everything. I know it's hard to get into your doctor's office. It's hard to get in touch with your doctors. You don't want to go to the ER, even though sometimes you should or you have to. But I will do my best to get back to everybody and manage all the complaints and questions. And even if it's just questions, you've texted me questions, others have texted me questions. I try to be as up to date as I can and sort of give you the real answers. So anybody's free to call me anytime or at least text me, and then we go from there.
All right. I can tell people from experience, Alon has treated my dad, my mom, my brother, all visiting Florida from overseas. He's treated my children, he's treated my neighbor's children, my best friend's children. Alon's been around. It sounds really bad, but he's been around. Bertie's asking, are you covered by insurance, for example, Medicare?
No, we don't take insurance, but what I do is send people a super bill that they can submit to the insurance companies, and sometimes they'll reimburse them, like Medicare might, especially now, especially for telemedicine and things like that. Also, through the pandemic, I initially had posted on my site that I was going to do it through March 31st, but for the most part, through the pandemic, I'm not charging for any telemedicine calls. So if I call in prescriptions or if I'm doing any telemedicine stuff, I'm just not charging for it. I know people are having a hard time with getting laid off and furloughed, losing jobs, businesses are shut down. So, knock on wood, fortunately, I still have a primary job and the business is something that I'm building for the future, so I can help out that way. So for any telemedicine calls, I'm not charging. If I do make a house call, yes, I do charge. I don't take insurance, but you get a super bill that you can submit to insurance companies.
What is your phone number? And I will post it a little bit later, but if people are listening and want to write it down, maybe you could provide them with the website and the phone number.
Yep. So the company's DoctorsOnCall365. It's on Instagram and Facebook, and there's a website, it's either DoctorsOnCall365.com, but Instagram or Facebook. My phone number is 786-577-9302. And again, feel free. The easiest thing to do is to text me because I get a notification and then I can always respond. Like Roni found out this morning, I got off of work at 3 and I slept in a little bit, so I apologize. So if I don't answer, it's either that I'm at work or I'm sleeping. But I do my best to get back to everybody and, again, help out as much as I can.
Perfect. Guys, if you have questions, feel free to continue. I'm looking at my phone. I'm looking down because I'm looking at my phone right now. If you have more questions, please let me know. If you're late and you wanted to ask a question, feel free to text me and I will try to do my best to get to Dr. Alon and get you the information. Overall, Alon, we know you got home at 3 a.m. or a little bit after, according to your wife. And we truly appreciate you for joining us this morning. And, you know, if we can do anything as a community to help, to give back, please don't hesitate to let us know. A great video came in this morning from a nurse that works in the ICU and regional. She's one of our group members of Cooper City Buzz. Her name is Holly. And it just showed one of the ICU patients being wheeled out into a regular department. And you know what? Me personally, you know me, but not a lot of people know my personality. That broke me. I teared up. It's just something that's very emotional, you know, on all of us. My parents, oh, look at me. My parents are in Israel. They've been indoors for for a month and a half, almost 2 months, as have my brothers, my brother in Phoenix. You know, everybody's got family all over. Nobody is untouched. We are all in this together. We thank you. You have a family, your kids, who I know, your wife. We thank you so very much for joining us this morning. And we truly, truly hope to see you under better circumstances next time.
No, thank you so much for having me on. And again, thank you to the community. It's been absolutely amazing outpouring of support and love and all the food and just, you know, again, I also encourage people to take care of each other. Again, we're having a rough time, but we're doing okay so far. The community itself, I know, is also having a rough time. So as much as the medical community is getting support, and we truly, truly appreciate it, and the community is amazing. Like I said, you know, let's support our small businesses, our restaurants, our community, our members that might have lost their jobs, and, you know, make sure that they're doing okay and they're getting fed and the kids are okay. So, like you said, we're all in this together, not just the medical community, but, you know, the financial fallout will also be difficult after the healthcare crisis is over. So, I think we have a long road ahead of us, but from what I've seen from our community, I think we're going to be okay.
Yeah, I've seen things that I could have never imagined, you know, as far as our community coming together. And as you know, I work all of Broward and Dade and Palm, and there's something special. We're not called someplace special just for giggles. There's definitely something special about our whole area, the whole Broward, the whole of South Florida. Everybody comes together. It doesn't matter. It doesn't matter your faith, doesn't matter your language, doesn't matter what barriers you have. People are coming together, handing out food. People are buying groceries for each other. There's a lot of good that's going on right now, and I'm so happy that we're all involved in it, and I'm so happy that you're a part of it. You know, everybody is saying thank you on the feed. We truly appreciate you. We truly appreciate all your staff. Please do tell them thank you from the community. And we thank you for your time. Go back to sleep.
No problem. Thank you for having me on. And again, if anybody's got questions, they can text you or just text me and I'll be around.
Yeah. Thank you so much.
Okay.
Have a good day.
You too. Bye.